Good afternoon, everyone. This is Ingrid Salazar, Health and Immigration Community Educator here with Central Valley Immigrant Integration Collaborative. We're also known as CIVIC. Today, we are doing a Facebook Live on a health matter. It will be in English, so before I continue in English, I'm just going to give a quick disclaimer for our Spanish-speaking community. Buenas tardes, comunidad. Espero que se encuentren bien el día de hoy. El día de hoy vamos a hacer una transmisión en vivo sobre el tema de salud, solo que será en inglés, el idioma inglés. Entonces, tuvimos una transmisión en vivo sobre el mismo tema más o menos hace 2 semanas atrás. Si gusten obtener información acerca de este Facebook Live, entonces ese video quedó grabado y archivado en nuestra página de Facebook, igual nuestro canal de YouTube, es sobre el ACA for DACA o DACA para los recipientes de DACA. Entonces pueden buscar eso, pero esto será en inglés para los que entienden o tienen conocimiento del idioma inglés. Now I will continue in English. I was just notifying our community that this Facebook Live will be in English today. We did have the same topic that we covered about 2 weeks ago for our DACA recipients who understand and speak Spanish. But today, as I introduce myself, I want to let you guys know that we will be covering the topic of the Affordable Care Act for DACA recipients, and we'll go a little bit deeper into that in just a few minutes. But before that, I want to invite folks who are tuning in today to follow us on our social media. Right now, we are live through our Facebook page, but we also have our YouTube channel as well as Instagram and Twitter, also known as X. So go ahead and follow us there. We'll be providing more updates as the days go on with this topic, along with any other topics related to immigration and entrepreneurship. As you all know, those are our 3 areas of focus here at Civic. So we are constantly updating and informing you guys of any changes going on in the community, as well as events that we have. So go ahead and follow us there. Also want to just remind folks that you can ask your questions as we are going through this presentation today. Just be sure to put them in the comments section, and we'll cover those at the end. Or if our special guest sees that we have a little bit of time to cover them, then we can do that. But if not, those will be at the end. So as I mentioned, today's topic will be on the Affordable Care Act for DACA recipients. It's a health coverage option for DACA recipients. Really important topic. So if you're a DACA recipient, or if you have a family member or someone that you know that is a DACA recipient and does not currently receive medical insurance or is having issues obtaining some type of medical insurance, then this is the video for them to watch so that they can obtain this more information on this and how to apply for that. So I will now go ahead and pass it over to our special guest, Ana Alvarez, to introduce herself and to take it from there. Hi, Ana. How are you?
Hi, Ingrid. Thank you so much for having me. My name is Ana Alvarez, and I'm a campaign organizer with an organization called Health Access California. We are a statewide health consumer advocacy coalition, and that just means that we advocate for quality, affordable healthcare for everybody who calls California home. I'm here to give you guys a presentation on health coverage options for those who have DACA. So I'm really excited to give you guys this presentation today. And we can go ahead and get started. In the next slide, I just wanted to give you guys a brief description about the campaign that I work on. It's known as Health for All. It's possible that some of you all have heard about it, that you've been involved in it. But for those who are not sure what it is, it's a campaign that advocates to remove exclusions to our healthcare system so that everybody who lives here in California is able to access healthcare regardless of their immigration status. This is a campaign that is responsible for all of the Medi-Cal expansions to undocumented folks. So back in 2016, we got Medi-Cal for undocumented children, and all the way up to this year, where everybody, regardless of immigration status, is able to access Medi-Cal as long as they meet the income requirement. So over the course of these 10-ish years, there's been over 1 million undocumented Californians who have been able to get Medi-Cal. And so that's kind of the work that this campaign has done. We obviously still have a lot of work to do just because, our healthcare system is not perfect. It still has exclusions. And so the work that we're going to be doing for the next couple of years is making sure that we remove all of those exclusions so that everybody, regardless of their immigration status, can access healthcare here in California. And so that's just a little bit about the campaign. But I did want to move on to the next slide and talk to you guys a little bit about two programs that are available for those who have DACA and need healthcare. The first one is the Medi-Cal program. Some of you may be familiar with it already, but it is the low cost to no cost public health insurance. This is all paid for by the state of California. For some people, it's completely free. Other people have like a small fee that they have to pay to be able to access it, but generally it's pretty low cost or free. The Medi-Cal program offers a whole variety of services that one needs in order to be able to get healthy and stay healthy. So like preventative care, like emergency visits, all that kind of stuff is all included. In a few slides, there's going to be like a bunch of like benefits that are offered through Cover California, but those are almost the same exact benefits that are offered through Medi-Cal. So in a few slides, we'll kind of lay out all of those benefits to the Medi-Cal program. But I mentioned earlier that the Medi-Cal program is an income-based program. So you need to be able to qualify for it just based on how much money you earn every year. And just as an example, for a family of 4, like let's say you are 2 parents and you have 2 kids, the income that you need in order to qualify for Medi-Cal is $43,000 or below that. So this program is generally for low income folks. And luckily, immigration status no longer matters in terms of applying and being able to be eligible for Medi-Cal. Undocumented folks can access it. DACA recipients can access it. The only thing that really matters is the income. And then in the next slide, I can go over a second option that you all have. If you have DACA, which is Cover California. And Cover California was established by the Affordable Care Act, or Obamacare, way back when Obama was in office. And the way that I like to think about Cover California is it's kind of like a store where you go to the store and you're able to purchase health insurance. They have all these different brands that you can choose from. You can shop and compare them to see which option is the best one for you. And the great thing about Cover California is that it's the only kind of marketplace for health insurance where you can also get help with paying for those plans. So the federal government helps a lot of folks with paying for those plans. And then the state of California also invests a lot of money so that these plans and using the plans is actually affordable for people. So like I said, Cover California is like the only place where if you have to purchase health insurance, it's the place where you can get financial help to pay for it. And the financial assistance that one can get to help pay for these plans will all depend on your income. So if you're a little bit of a higher earner, you might get less financial help to pay for your coverage. If you are a little bit more low income, you might get a lot more help to pay for your coverage. There's a lot of folks who have Cover California and it's completely free, or it's like $10 a month. It all just depends on what your income is. That'll determine how much federal help you get, how much state help you get. But what matters is that you get some help to pay for it. So that's a little bit about Cover California. And then we can go to the next slide. And this slide is basically the reason why I'm here. Earlier this year, the Biden-Harris administration made a change so that DACA recipients would be able to access Obamacare or the Affordable Care Act or Cover California whatever way you want to call it, but it's the same program. And so we're really excited about this change. And what's great about this change is that DACA recipients would also be able to access all the same type of financial help as people who have legal status and who shop on Cover California. So I mentioned earlier, like the federal subsidies, the state help to help pay for the plans. DACA recipients are also able to access the same kind of like financial assistance. So that we're really excited about that. And then in the next few slides, I want to talk a little bit about kind of what these plans mean and all that fun stuff. So this is a slide that I was mentioning to you guys earlier about what are the benefits that are covered with your Cover California plan. They're almost, I can't see any difference between these benefits and the ones that are offered in Medi-Cal. So it's things like the lab, emergency services, your prescription drugs, mental health and substance abuse disorders, preventative and wellness services, pediatric care, rehab, ambulatory patient services, maternity care, newborn care, and hospitalization. So it's a lot of the services that somebody needs in order to get healthy, stay healthy, or deal with any kind of medical emergency. So those are the types of benefits that are offered in any Cover California plan, and you will soon learn about all the different types of plans. But rest assured that any plan that you choose on Cover California is going to offer all of these benefits. And in the next slide is a picture of the different name brand health insurances that you can purchase on Cover California. So I mentioned it's a little bit like a store. You go on it, you're able to see all these different options. You're able to choose the one that fits for you and your family the best. They're all name brand. They all offer the same benefits. And in the next slide, you're going to see 3 different tiers that I have laid out here. And please forgive me, but I think this one is in Spanish, but the information is the same. I'll just explain it in English. But you have the bronze tier, the silver tier, and the gold tier. Like I mentioned earlier, they all offer the same type of benefits. You can buy, like in the previous slide, there was 12 different plans. You can choose, let's say, the Kaiser Permanente plan. And within Kaiser, they'll have these 3 different tiers. And so, like for example, the bronze tiers, you'll pay a little bit every month for that premium. But then when you actually go to the doctor or use the health insurance, you might pay a little bit more out of pocket. It'll be more expensive. The bronze plans cover 60% of the cost of your care. So just be mindful of that when you're shopping for plans. And then we do have the silver level plans. And we do suggest that folks, if you're, you have DACA, this is your first time enrolling and you're trying to see which one is the best bang for your buck, we do suggest the silver one just because the amount that you pay every month, your premium, it's pretty low. And then when you go to the doctor, you use the service, you don't pay as much. It's a pretty reasonable amount. The silver level plans cover 70 to 94% of the cost of your care. So it's a pretty good plan. But again, do your homework, do your research, choose the plan that looks the best for you, that you can afford, and just depending on what your healthcare needs are, that'll, I think, play the biggest factor in determining which plan you choose. And then last here, we have the gold level plan where the amount that you pay every month is pretty high. But then when you go to the doctor, you don't pay very much. It covers 80% of the care. So again, do your homework. Cover California, they have like a really great shop and compare tool on their website where you can like input your information, like your income and what part of California you live in. And they'll kind of show you like all the different plans that you can purchase, what it's going to cost you every month. Like if you go to the doctor, is it going to cost you $35? Is it going to cost you $10? you're able to see all of that information on there. You can get quotes and all of that stuff. So highly do suggest that you guys use that shop and compare tool. And then in the next slide, I wanted to share a little bit of information on vision and dental coverage. So Cover California, they do also offer both of these types of coverage for adults and for children. For children, I'll mostly talk about children just because it's a little bit more of a unique case. But for children who, need dental coverage, it's free, but like when their family enrolls into Cover California, at least one adult in their family has to also enroll into dental in order for the children to be covered. So, for example, let's say me and my partner and our family chooses to purchase through Cover California, at least me or my partner needs to purchase dental coverage for ourselves in order for the children to be covered as well for free. Um, so I think that's a pretty good deal, not gonna lie. But just wanted to make that note for you all who might have kids. And then for vision insurance, children can also get enrolled into vision coverage, and it's free for children. Um, in doing my research, I did not see anything about adults needing to be enrolled into vision in order for the children to be covered. I think you can just enroll the children into vision and it's covered. I think it's just for the dental that, at least one adult in the family needs to be enrolled in order for the children to get that free coverage. So those are the two vision and dental coverage options. And then in the next slide, I wanted to go over a little bit about how you can get enrolled, when you can enroll, and all that fun stuff for those who have DACA and this is your first time having eligibility for this program. It's going to be a whole new process, and one that you'll get a lot of support in. Cover California has a whole team dedicated to supporting DACA recipients with enrolling for their first time. They have a number that you can call, which is 800-300-1506. They'll answer any questions that you might have about your particular case or with the application or any question that might come up with a typical kind of like enrollment situation. And they're also able to connect you with any in-person help that you might need. So for example, if you want to fill out the application in person, but you want help, they can kind of show you which locations you can go find help at. So highly suggest you call a number if you have any questions about that. But then you can also go on their website, covercalifornia.com/support/contact-us, or just covercalifornia.com. Both of those are very easy websites to navigate. And you can also get quotes on their website. I'm pretty sure you can even enroll on their website. It's pretty easy to use. And like I said, they have a shop and compare tool. Like, do your homework with the shop and compare tool to see which option is the best one for you and your family, what it's all going to cost you. And then as far as when you can enroll into Cover California, Cover California has an open enrollment period every year. It starts November 1st and it goes until January 31st. And this is the first time DACA recipients are able to apply. They have to do it within open enrollment. So DACA recipients can enroll as early as November 1st of this year. They can enroll as late as January 31st. And because this is the first time that DACA recipients are eligible for Cover California, they have what's called a special enrollment period. And this special enrollment period allows you all to get your health coverage or like to let the coverage begin really soon. So for example, if you apply for coverage in November, your coverage can begin as early as December 1st. If you apply in December, your coverage can start as early as January 1st. So that's what the benefit is of special enrollment. And now, because you know, DACA is like a special type of status. In the next slide, I did want to go over a few documents that you may need to submit in order to be able to submit your application for Cover California. So the two documents that you could submit, they just need to verify that you have DACA, is either the Notice of Action or the I-797, which is issued by USCIS, and it shows that you have deferred action on your status. So you can either submit that form or that document, or you can submit your employment authorization document or your I-766 indicating your authorization to work in the United States. So those are just two documents that you can submit. Again, they just need to verify that you have DACA. And then as far as when you need to submit these documents, Cover California gives you 95 days to submit these documents. But I will say that you can ask for an extension. Like, let's say you need a bit more time to get your documents in order and submit them. You can ask for an extension, but again, you have to ask for it. But 95 days, that's what, like three-ish months, give or take, to submit these documents. And while they're waiting for the documents, you will be conditionally approved for Cover California. So just so y'all know that. And then on the next slide, I wanted to talk a little bit about public charge. There is always a lot of fear around public charge, and for obvious reasons. There's been a lot of, really bad anti-immigrant rhetoric that's been going around for many years that has put a lot of fear in our communities, who are undocumented. Even, immigrants who have legal status, sometimes they get a little bit scared about public charge. Very valid fears. But we do want to reassure you all that if you apply for either program, so whether it's Medi-Cal, whether it's Cover California, applying for it, enrolling in it, using the benefit, it does not count as public charge. So please go ahead and take advantage of both of these programs, whichever one you qualify for. There's been a lot of blood, sweat, and tears over the last 10 years so that this benefit is available to undocumented folks. So don't let it go to waste. Use it. There's no point in letting fear overtake us. When this benefit is available, use it, especially those mental health services in these next couple of years are going to be really crucial. So please use the coverage, and we'll update you guys if there's any changes. But right now there are no changes. So go ahead and use both of those programs, whichever one you qualify for. And then at the very last slide, I just wanted to share, again, my name and my email. If you have any follow-up questions about what we're calling DACA or ACA for DACA, and we call it ACA because it's like Affordable Care Act. So if you're curious about that, if you have any follow-up questions, or let's say you are still excluded from Cover California because you don't have DACA, you're undocumented, and you don't have any other option for healthcare. I mentioned earlier that we're doing a lot of work to make sure that you also have the option to purchase through Cover California. It's going to take a lot of hard work, a lot of advocacy. So if you're ever interested in getting involved, you can feel free to reach out to me. I'd be happy to give you kind of like a overview of what we're doing and how you can get involved. And yeah, I think for now that is my spiel on ACA for DACA. And please let me know if there's any questions that I could either answer or follow up on.
Thank you, Anna, so much for covering this topic today. There are DACA recipients that don't know about this opportunity yet, so this is a really great chance for them to have this information in hand, especially if they're not Spanish speakers. I'm glad that you were able to do this presentation also in English, aside from in Spanish. And thank you for also clarifying that Medi-Cal is not considered public charge, because we do often get community members who ask if receiving Medi-Cal or public benefits as such is considered a public charge, and a lot of folks don't apply for the simple fact that they think that it is. So thank you for clarifying that for the community. I did have one question. Going back to the slide before public charge, I know that you talked about, and we can bring that up here. So during this slide, I know that you mentioned that as they wait to find out a decision if they were approved or not, they are conditionally approved. Is that what you had said? And what does that mean?
Yeah, that is what I learned during one of the Cover California webinars. However, I don't know what it would all entail. Like, let's say, what I would be curious to know, and I can definitely follow up on is like, let's say you're conditionally approved and you go to the doctor. Will that doctor's visit be covered? That's what I can definitely get clarity on, and I can follow up with you, Ingrid, and maybe we can I don't know, drop it in one of the comments or something like that. But I can definitely get back to you on what exactly being conditionally approved means.
Thank you, Anna. Yeah, because I'm thinking the same in that aspect, that maybe that must mean that while they await a solid response, maybe they do have the opportunity to use it while they wait for confirmation if they were approved or not. So yeah, we could definitely follow up with you, community. We could drop it in the comment section. We also can have another live broadcast and invite Anna to provide more information. Also, if there are any updates in the next few weeks, we can also provide that to you all. For the time being, we don't have any more questions, but I just want to say thank you again, Anna, for coming on and sharing this information for our DACA recipients. And if you are watching this after the live ends, know that this information might not be for you, right? But if you know of somebody who is a DACA recipient and may benefit from this opportunity, please share the Facebook Live with them. That way they can obtain more information. In the comments section, we've also shared the number to where you can call to enroll and get more information and more details, as well as the website for Covered California. You can contact them for any support that you need. So I highly encourage, if you want to obtain more information, that you do either call or check out their website. And then stay tuned as well, because like I mentioned, we might be doing another Facebook Live in a couple of days or a couple of weeks, and we may be providing new updates if there are any. So if you have any questions at the end of this video, please drop them down in the comments. That will help us so that we can answer in a future Facebook Live. But again, thank you, Anna, for joining us. And if there are no last minute questions or comments that you would like to give, then I believe this would conclude today's Facebook Live.
Thanks so much for the invitation, Ingrid, and the whole civic team, and for this community for, always welcoming me with open arms. Always happy to talk healthcare with you guys.
Thank you, Anna. Thank you for always being so open to helping us and supporting us, as well as informing the community along with us. Alrighty, well, thank you everyone for watching today's Facebook Live. This will conclude today's live broadcast. Have a good day.